I'm Mike Frick. I'm the co-director of the Tuberculosis project at Treatment Action Group. TB has been and remains the leading cause of death among people living with HIV globally. And so there's really no ending the HIV epidemic unless we also address tuberculosis. Each death from TB is preventable, and it deserves much more concerted attention. I think what really keeps my motivation to do this work is the fact that I've never been bored at TAG. And this work is just endlessly interesting and really valuable and needs to be done. And TB, for me, feels like a sort of lifelong commitment as something that I want to work on. I think many people in the United States are surprised to hear that tuberculosis is still a global pandemic and was the leading infectious disease killer before COVID-19. And it just goes to show how short memories can be. I mean, it doesn't take going back too many generations for nearly every American family to have some kind of TB experience. TB was the leading cause of death in the United States up through the beginning of the 20th century, and 1 in 7 Americans were dying of tuberculosis at the turn of that century. These problems are really global, and we can't address any of these issues if we only work on them in the context of where we live here in the United States or North America. We have to make sure that we're sharing innovation globally with countries that are affected, and we have to have a more global outlook and really consider equity, not just for ourselves, but for others around the globe who are battling these infectious diseases.